Also tonight, Pfizer and Moderna's COVID-19 vaccines emerging as frontrunners as the medical community looks for answers to slow the coronavirus in its tracks. One local medical official is weighing in on those drugs and why everyone should remain guarded and not attend large social gatherings this holiday season.
Good information in terms of these vaccines available from Pfizer and Moderna. They both performed very well. That we heard the Pfizer vaccine overall worked, it had an efficacy of 90%, and then in some populations up to 94%. And Moderna's vaccine also performed quite well at about 94.5%, very close to 95% efficacy. So that's great news in terms of the world of prevention and COVID vaccines.
Consultant on the COVID Task Force and director of the HIV/AIDS Infectious Disease Program, Dr. Nakia Forbes, speaking to the latest COVID-19 vaccines and who would get the vaccines once they become available.
First rolls out, it's probably going to be for people who are most at risk, first responders, and those people who are more likely to have severe and critical illness and die. So it would be the vulnerable population, those older persons, and then younger ages would be included, including children.
Also, by way of antibody treatment, the Food and Drug Administration allowed emergency authorization for the use of the drug Regeneron. Dr. Forbes offered her thoughts.
But we have to look at what the science shows us. And so a lot of these monoclonal antibodies and antibody preparations, they're not necessarily demonstrated in clinical trials to be helpful in people who have mild or moderate disease not needing hospitalization. And there is some lack of precision in terms of some studies. There's nothing that has a clear mortality benefit right now, meaning there's no cure. And so you really have to weigh this in terms of the side effect profiles for people who have severe illness and make a decision based upon those things. So right now it's not standard of care, unfortunately.
And with the holidays fast approaching, Dr. Forbes is discouraging large social gatherings.
We know is that for COVID to be transmitted from one person to another, it needs persons that are gathered in close contact, taking down your mask to eat and drink around a table. There could be elderly people there. That can really increase the risk of COVID being transmitted. And keeping that in mind, it would be good to have smaller gatherings this year, like individual family groups, because the gathering could cause COVID to be transmitted.